As a body, we're endorsed to reach the sick, needy world. We embrace God-given chance to move on with the goal. With constant growth in training and with service to all, we strive to make the world a better place for all. Marching on for excellence to the top of the world. We commit endeavor to change mankind. We commit move together as KMTC.
The Kenya Medical Training College is a mid-level health training institution under the Ministry of Health in the Republic of Kenya, mandated to provide training and research and consultancy services. Having started in the year 1927, KMTC has grown tremendously to be the largest medical training institution in East and Central Africa and beyond. With about 51,000 students attending 83 medical courses, KMTC makes the biggest contribution to the health sector in Kenya, churning out 12,000 graduates every year, accounting for 85% of hospitals' workforce, which makes it undoubtedly one of the key pillars in the achievement of universal health coverage.
I'm very happy for this opportunity to share the progress of Kenya Medical Training College. KMTC started in 1927. As you know, we have 71 campuses across the country.
Kenya Medical Training College is the training arm of the Ministry of Health in terms of training competent health workers who should be able to support the ministry and also support the private sector.
We have immensely contributed towards universal health coverage. We can say this has contributed immensely in ensuring that we have competent health workers in our hospitals, in dispensaries, county hospitals, in our referral hospitals in this country. We have also introduced courses geared in ensuring primary health care is maintained at our communities.
This unprecedented growth has been achieved through the support of government, board of directors, hardworking staff, students, and sound management. The college operates under the board of directors headed by a chairperson. The board then appoints the CEO, who is charged with the day-to-day management, assisted by senior managers and campus principals.
Our courses range from certificate, diploma to higher diploma, which reflects the institution's responsiveness to the needs of our nation. We have 7 faculties with 18 departments offering
83 medical courses,
Faculty of Clinical Sciences, Faculty of Diagnostic Sciences, Faculty of Information Technology and Medical Education, Faculty of Nursing, Faculty of Pharmaceutical Sciences, Faculty of Public Health, and the Faculty of Rehabilitative Sciences. The 18 departments' programs are Clinical Medicine and Surgery, Dental Technology, Health Promotion and Community Health, Health Records and Information Technology, Medical Education, Medical Engineering, Medical Laboratory Sciences, Nutrition and Dietetics, Nursing, Occupational Therapy, Optometry, Orthopedic Technology, Pharmacy, Public Health, Radiography and Imaging, Orthopedic and Trauma Medicine, Community Oral Health, Physiotherapy.
Our libraries in all campuses are equipped with state-of-the-art technology, vast collection of reading materials, and specialized services of friendly, efficient, and helpful staff.
We have worked on our libraries in all the campuses that we have. That means then renovating them, painting, stocking them with the latest materials, books, periodicals. We've been able to do that.
We have the state-of-the-art facilities, talk of medical engineering facilities, talk of physiotherapy, occupational therapy, dental, nursing, skills laboratories. We use those to do simulations that are similar to what they'll be able to see when they go and start working in the health facility.
Taveta campus is well endowed. We have a library, a huge library with a seating capacity of over 200 students. We have a skills lab that spans over 3 floors. We have 9 well-furnished classrooms. We have good training equipment. And in this region, KMTC Taveta stands out as an institution with modern training infrastructure.
At KMTC, we offer a wide range of courses from certificate, diploma to higher diploma. Our courses are tailored to meet the ever-changing needs of the country's healthcare system.
KMTC often mounts courses based on the needs that are felt within the county or the community. There is a needs assessment that is carried out. Oftentimes, data from the health information system may also guide, so that the need for a specific course before it is mounted is realized.
We don't just start programs annually. We interact with the community, especially the county government of West Pokot, the health sector. We discuss and we agree and propose to the headquarters so that that program is started.
Fairly often, we respond to requests from the ministry to mount this program, reintroduce this program. For example, there's a program that was called Cluster Technology. We've renamed it Orthopedic Trauma Technology and Technician.
We keep introducing new courses in line with the market changes and needs of the global community.
Our curriculums are reviewed within 3 to 5 years, and we do this in line with the market changes or trends that are happening, new technology, new information coming in.
Our expansion has been informed by the market needs. So health changes. The needs changes. Kenya has expanded from those times when people went abroad for specialized courses to where almost every county is able to offer things like nephrology or intensive care.
To pursue a certificate course, an applicant must attain a minimum of C- with specific qualifications in cluster subjects in KCSE. For diploma programs, you must attain a minimum of C- with specific qualifications in cluster subjects. While for higher diploma programs, a candidate must have attained a diploma course. The institution attaches great importance to research activities. Since the college's recategorization to a training and research institution, KMTC has invested in training and mentorship of young researchers. It is envisioned that researches conducted will be used to enlarge the knowledge base that supports evidence-informed policymaking at all levels of the health sector.
We want to strengthen our research department so that we can undertake research work from the ministry, from development partners, and this is one area whereby we have achieved a lot and will continue to strengthen those particular departments to ensure we are mobilizing resources coming to KMTC, and at the same time consultancy, and we have developed a policy pertaining to this.
We provide consultancy services. We do research, because you cannot delink training and research. For the students to eventually graduate, they must undertake projects. And these projects are driven by research.
Our examinations are internally administered but centrally coordinated from the headquarters to ensure credibility and uniformity of training across our campuses.
In every semester, we have to examine our students. This to ensure that there is quality of this training. The examinations must be checked by both internal and external personnel who are well trained for that purpose.
To keep abreast with the advancement in technology, KMTC has not been left behind. We offer e-learning services to enable our students study remotely.
We are rolling out e-learning programs to ensure that we provide the opportunities for people to train. And this will go a long way, especially for those people who want to do continuing education. These are people who are already working. It may be very difficult for them to get a full release by the employer. And through e-learning, they'll be able to learn with ease.
Increasingly, it has become necessary to embrace new technology in the way that we teach, While acknowledging that we are a hands-on training institution, it is necessary for us to embrace e-learning platforms. Our students have access to e-learning materials through our libraries, but also being able to offer courses, some theory courses, through the e-learning platform.
Since the advent of the COVID-19 pandemic in Kenya, the college has escalated e-learning use to ensure continuity of learning while observing the Ministry of Health protocols. The Board of Directors is mandated to develop policies to strengthen internal processes and procedures, steering the college to enhance training of health professionals to address the gaps that exist in the health sector.
At the board level, we deal with other matters. We deal with the policies that guides the college.
The board has 4 committees in charge of academics, training, standards, and ethics, which are mandated to oversee the academic performance, including expansion of courses and students' affairs.
We are the committee that is charged with expansion of our courses, expansion of our campuses. We review our student affairs. We review the reports on examinations, graduations. We also monitor our quality management systems within the campuses. And we also review reports and recommendations from regulatory bodies.
The board also has an audit committee, finance, planning and development committee, as well as a human resource committee to oversight the operations of the institution.
The committee's mandate resonates around having internal audit, external audit. The internal audits are carried out by the internal audit department. Of course, the external audit is carried by the mandated body by the government. It's in charge of risk management, ensuring that all the assets or the risks in the institution are documented and are attended to, are addressed within the confines of the laws of the country.
Generally, we receive reports from the management, and we have committee sittings, and thereafter we advise the board. We make recommendations to the board on matters, human resource strategies, human resource policies, and human resource procedures.
Among these reports which we receive are on financials report, on ICT, on communication, on performance contract, and also on legal issues.
The college has an academic council led by the Chief Executive Officer that oversees the academic and training matters. The introduction of Enterprise Resource Planning, or ERP, has enabled the board to have increased efficiency in resource distribution and management through the use of technology.
To support and ensure that we manage our resources, we have put in the Enterprise Resource Platform, which in short is ERP, and this has several modules. There's the academic module, we have the human resource module, we have the finance module. And within those modules, we have subsections of several sections within those modules. Like in academic module, it supports and helps us to prepare timetables, ensure that we are able to upload the marks through electronic system, and that gives check and balances.
To ensure we have a robust and vibrant workforce, the management continues to prioritize the welfare of staff through provision of medical scheme, better retirement package, and remuneration.
We also ensure that we have a better retirement package for our staff. That's why we have over 4 billion at the moment that we've been able to contribute as a board, together with our staff contributing.
We are competitive in terms of remuneration for the members of staff, and we have the highest in terms of the numbers, in terms of their training in their respective areas of specialization. We have ensured that we have even members of staff who have doctorate degrees in their areas. We also encourage the members of staff to ensure that if they have a bachelor's degree, for instance, when they join us, we encourage them and support them to move to the next level where they do their master's, and also they can do their doctorate level.
As an institution, we are ISO certified with ISO 9001-2015, which has improved our training for better health and ensuring that high standards are kept and maintained.
We are there to the standards, and all our training services and all our teaching and learning activities, they are all guided by ISO standards.
There are procedures that are formulated to ensure that teaching and learning is done effectively. We have documents like we say student attendance registers, we have timetables, we have schedules for teaching.
The Kenya Medical Training College campuses are nationally distributed and are centrally coordinated from the headquarters in Nairobi for quality assurance.
Decentralization of health training means training people closer to the community. It means we are able to reach to the different communities and meet the challenges as they happen and design interventions that are specific to the situations that we encounter on the ground.
The introduction of the college here helped the community so much because right now, you know, the students from this community, even some of them are day scholars, so they can even come from their houses to the college, then in the evening they go back. So that way actually they've enabled some parents who could not afford accommodation if they are far to actually take their trainings in this college.
We are able to attract the students from within the locality. When they come from within the locality, and we insist on at least 30% of the students coming from within Isiolo County, then we are able to train them and they are going to offer the services to the people within the Isiolo County.
Kabla kuanzisha hiki kituo, ilikuwa hali ni ngumu. Tulikuwa tunatamani vijana wetu nao waende kama zile kozi za kule bara. Kwa hivyo kulingana na wakati huu ambao hiki kituo kimekuja huko kwetu, yani ni msaada mkubwa, maanake imekuja karibu na sisi. Tulikuwa zamani tunasikia Kmtc iko wapi Nairobi, tunapata Mombasa, Kilifi. Huko kwetu ilikuwa hakuna. So hii ni ngome iliyokuja huko kwetu. Yani ni faida kubwa kulingana na mimi.
The college has grown over the years, bringing the total number of well-equipped campuses to 71. The 71 campuses are each headed by a principal.
There is very well-organized linkage among the institutions as well as KMTC headquarters. As the headquarters, where policy formulation is done, there is also direction or directives of how training is supposed to be carried out. And this is then channeled to the implementers in the various satellite colleges, Kisumu being one of them.
As a campus, we have to make sure that we comply with all the instructions and policies that are generated to us, and make sure that the documents that are given to us, if they are, for example, the statutes, we have to comply by that, because those are the ones that give us direction on how to move on.
All the campuses are strategically located close to key health facilities where students go for their clinical exposure.
There's a lot of benefits in having the county referral hospital next door to us. One, we are able to work closely with them, program our students in the morning, they're in the theory class, in the afternoon they're in for the practicums within the health facility and back.
Our students will not take time traveling. Also, the trainers who are following up these trainees at the training health facility, they will also save time.
There is an advantage for having this campus in close proximity to a referral hospital. One, effective monitoring and supervision of the students. Because now it is possible for the campus to have a schedule. At least every week, students are they are visited the hospitals for only monitoring and evaluation.
When it comes to practical training, we have also signed some MOUs with the neighboring facilities, starting from the referral hospital here, where our students are able to visit even during holidays, during nights, and during the day. And we have some mentors to ensure that everything that is done according to the standards.
We have enough facilities for us. There is enough time for us to go for practicals, just at the hospital, which is across the school.
the nurses, the clinic officers who are being trained, the whole Kmtc, of course, and particularly ours here, they come in to help us bridge the gap of the medical workforce.
We are able to work together with the campus, with the guidelines that are well laid, and we are able to guide our students to become responsible citizens.
Our college facilities are also well branded across our campuses for uniformity and visibility, while each campus is equipped with a bus and double cabin vans to facilitate smooth movements of learners and staff.
We've been able to buy additional buses to the campuses where we do not have transport for the students, including our staff, by providing double cabins for our principals and our staff in those particular campuses. So we've done this.
In order to make certain that our students have a conducive learning environment, Kmtc offers students the best accommodation within the college and also partners with private sector where necessary to accord our trainees safe and secure hostels, which impacts directly to the local hosting community economically.
Because of KMTC Voi campus, work is now there. As it expands, this hostel will expand. Movement from elsewhere in the county to the college will be facilitated by border borders, which means they'll get a business.
The setting up of Nyandarua Medical Training College has been of great benefit to the people of Nyandarua. They are providing accommodation to the students, they are providing the food and vegetables. Now the students, when they go to attachment, they are going to our facilities and also providing much needed medical work.
We maintain a close relationship with our development partners to enable us meet our strategic goals in the training of health professionals. Our key partners are World Bank, Beyond Zero, USAID-funded Funzo Kenya project, JHPEGO, CDC, and Bengton and Dickinson of United States, Management Health for Science, or MSH, Kenya Hospitals Palliative Care Association, World Health Organization, Sight Savers International, Fred Hollows Foundation, Liverpool School of Tropical Medicine, Higher Education Loans Board, Book Aid International, and Jackson's Clinic, among others.
So what we hope to accomplish here is to raise the level of education in orthopedics, neurology, pediatrics, geriatrics, cardiopulmonary, integumentary, women's health, oncology, all areas of rehabilitation medicine. Our goal is to establish a higher level of education, to establish specialties in each discipline, to establish what are known as residency and fellowship programs.
To ensure constant college expansion and sustainability of programs, we are proud of our partnerships with both the National Government Constituencies Development Fund, or NGCDF, and various county governments.
At the onset of devolution, when KMTC approached us, we were very eager to partner with them. In Makueni, we have about 1650 students who are studying here. We donated 5 acres of land. We also built classes, furnished them. At Makindu, we partnered again for the second KMTC campus. In Tawa, there is already through CDF an annex, which I think is going to develop into a campus. With time, I think KMTC will become a major player in terms of helping to develop community health.
We decided to partner with KMTC in terms of training. So currently we have 495 students sponsored by the county government. It is going to impact us both in terms of human resource training, but in terms of the economy, we are also bringing in additional market and growing our county GDP from those campuses. We believe that KMTC is going to impact healthcare globally, because a number of these graduates will leave this country to go and work in other countries, and they will send us foreign direct income.
We are on the border of Kenya and Ethiopia, very far away from the capital. And therefore we planned to establish a KMTC because of the need that our people need to have these courses in our own county to cut on the costs
and all these are the problems that accompany people who have to travel to other parts of the country. We intend to open the college with estimated population of 1,200. We have a fully fledged laboratory, the administration block, the tuition block, and all this kind of thing. We intend to establish another campus in Moyale.
The solution, therefore, of building more facilities is to have more of your own people. They are trained and they go back home. We have now invested a total of 168 million Kenya shillings. We have built offices, we have built hostels, 200-bed hostels.
Through NGCDF, the college has received various key infrastructural support in social amenities, academic blocks, hostels, and also transportation means for our students to their clinical areas, enabling easy access to the community, who are the main beneficiaries of our training.
We have also added a tuition block from my constituency in partnership with the neighboring constituency of Isiolo South at a cost of 10 million, 5 million each from each of the two constituencies.
This particular institution here is a manifestation of what the Constituency Development Fund can be able to do, should be able to do, direct impact on the constituents and Kenyans at large, those who are from here and those who are not from here as well. We put in the first 50+ million for this particular project. We signed at this very grounds an MOU where a certain amount of students would be recommended from the constituency to be able to go and study. We spent about 52 million, and now we want to add in the other amount to be able to finish the laboratory as well.
The college bus required us to raise about 6 million shillings, which we liaised with the CDF office in Nairobi and the community, which actually had no problem us spending 6.2 million shillings to get a bus for the students.
Considering now that we have CDF, I am thinking CDF will be very useful if we can partner with the Ministry of Health to have KMTC campus in Taveta. First of all, it will be a way of training our students, who quite a number of them are really well qualified to go to KMTC, yet they cannot get space in those KMTCs. This is a 400 million project, I would say. It has the main block, which is the administration block, which has classrooms. It has a library, the administration offices. It also has a computer lab.
On behalf of Board of Directors, staff, students, and stakeholders, I thank the government also, led by His Excellency the President Uhuru Kenyatta, for support towards growth of the college, enabling us realize our mandate. The college has been able to expand from 28 campuses across the country. We have now moved to 71 campuses across the country, with our students population moving from 19,000 students to the current number, which is over 51,000.
Tuko na title deed ya KMTC, tumepata ardhi kutoka kwenu nyinyi. Nitakuja kuweka jiwe la msingi kwa KMTC ya Samburu hapa, na ndio vijana wenu waweze kupata pahali ambapo wanaweza kusoma mambo ya nursing na mambo mengine ya kusaidia wananchi wa area hii. Si ni sawa?
These partnerships offer support to existing programs and campuses, while some partnerships with the communities have seen establishment of completely new campuses as purely community initiatives.
Wakati serikali ilianzisha hii program ya CDF, tukawa na kamati ya health ambao ilikaa ikaandika proposal. CDF ikakubali, ikatupatia 5.8 million kwa nafasi yote ambayo ilikuwa imepaki eka 29 na nusu. Kina mama na wazee ambao wako hapa, hata vyakula ambao wanalima, tuseme ndizi, matunda, maziwa, wanauza hapa. Na tena vijana wetu wengine tayari wamejipatia kazi hapa. Watu wameanza kujenga nyumba, hostels, ambao watoto wanafunzi wanapata mahali pa kulala, na hiyo already is an income.
We work with various regulatory authorities to bring out competence and quality in our training. Some of these bodies are Nursing Council of Kenya, Pharmacy and Poisons Board, Clinical Officers Council, Kenya Medical Laboratory Technicians and Technologists Board, Radiation and Protection Board, Nutrition Council of Kenya, and other relevant health regulatory bodies. The constant hands-on exposure that our students undergo while training ensures that our graduates have the relevant skills they can use after graduation, most times guaranteeing them job opportunities in the market.
Our students are also well-grounded. Apart from theory, what is also very important is that we sharpen their skills so that when they go to the job market, they are able to compete.
I started my professional training in Kenya Medical Training College. 2013-2017, I worked as the county executive member in charge of health and emergency services. So what I can tell our young graduates, the students in KMTC, you are in the right place.
The most unique things about training in KMTC is that once you are out of college, you're able to get a job very quickly, and also the type of quality of education you get, it's on a much higher scale compared to other institutions.
I joined Kmtc in September 2011 and I graduated in December 2015. Currently working in Mombasa Hospital as a clinical nurse. The institutions outside there, they want people trained from Kmtc mostly because what we get from here and what we apply outside here, they are quite relatable.
Our application process is online, which makes it transparent and easily accessible from any internet-enabled gadget at www.kmtc.ac.ke. Launch your medical career at KMTC to join 51,000 students at the college who aspire to improve the health of the communities they live in.
Ningependelea ama ningeonelea baada ya kumaliza hii kozi yangu ya community health development, niende nikafanye kazi kwetu nyumbani ambapo ni kijiji kinaitwa Kimurigo. Kuna kipindi fulani watu wanapigwa na mafuriko, tunashindwa kujizuia kutokana na magonjwa. Mafuriko yanakuja pale, yanakaa kwa muda, watu hawajapata elimu jinsi ya kuepukana na hali kama hizo, kwamba maji yanaposimama tunafaa kufanya vipi na ule usafi uko pale. Uzito niko nao kwamba nikienda kufanyia pale kwamba nitawasaidia hata community yangu. Si mimi peke yangu kwamba ninafaidi, hata wale community wanahitajika kufaidi kupitia mimi.
The quality of training offered in Kmtc is good, it's excellent. First, the lecturers reach out to us. We also reach out to the lecturers. And also, as a student, when you find something difficult in your studies, you can go and consult the lecturers.
Come and enjoy a wide range of courses from certificate, diploma to higher diploma.
For you to take a course in KMTC, you need to log in to www.kmtc.ac.ke. Now therein, you'll create a student portal with your name and your profile. You'll get a number of courses for you to choose. Now, each course corresponds to the grade that you got, and you'll know a specific course that you need to choose.
We have more than 80 specialized medical courses spread out through our 71 campuses in the country, making it the biggest contributor to the health sector and the most accessible college of choice. Kenya Medical Training College, training for better health.